Hello, everyone. It's another day with your fertility specialist. Thank God it's Friday. For those people that like the party, it's time to party, right? Well, let's start the party here. On behalf of House Hospitals, I love to say thank you, dear viewers. Thank you for liking our post. Thank you for sharing. I'm your host for today's session, Ruth Ogogo, and I have a very wonderful, I almost said beautiful. Oh yeah, I have a very wonderful guest with us. For those of us that were with us on Wednesday, you in person of Samuel. And for those of us joining us for the first time, yeah, he might just be new to you. Maybe it's about Dr. Samuelson. Yes, I a lot more about him. So maybe you could just check that back to get a bit about him. So he's a gynecologist. He's a minimal access surgeon. He's a fertility specialist, a very good one at that has so much passion for excellence, good clinical expertise, and all you can mention with respect to excellence, you can see it on him. Oh yeah, he deserves it and more. So that's just it, Dr. Samuelson. It's good to have you with us, Dr.
Thank you.
Samuelson. As
Good
we
to be
get
here.
started, dear viewers, with someone, call up someone if you need to do that. Drop your thoughts, your comments in the comment section. We will definitely respond to them. Today we're talking about what happens when all those hope seems lost. Yeah, this is just to make someone out there that feels there's no hope or nothing can be done. That's just still something that can be done as long as you've not given up. So today we have Dr. Samuelson to talk about that, to revive the hope of someone that's actually given up. So just right now, if you have someone that is struggling with fertility, just struggling with something, even though yes, it might be no fertility, but the person might just get something from this right here. We will look forward to your questions. Definitely answer them as they come. Okay, so Dr. Samuelson, when all hope seems lost. So you have many couples that actually experience this disappointment. When they wait month after month, keep waiting for their period is not forthcoming, or no, when they see their period, they are hoping that the next period does not come.
Yeah.
Like, okay, we hope that it's pregnancy, and
Yeah.
then the next thing they are seeing period, and they're like, God, not again. I'm sure that you've had these experiences with some clients when they keep waiting month after month that it will be a period, then
Yeah.
boom, the period comes. Well, from your experience, how common is this emotional trauma? I will call it trauma because it's something they are hoping never comes. Like, just hope pregnancy
Yeah.
just keeps them from there and then keep seeing the period. So it's more like period makes them cry because they're like, okay, when is pregnancy will happen? How often do you have to deal with women in this condition?
Well, more often than I would like. Um, it's my prayer that anyone that wants to conceive has that joy of holding their own baby. Women bear a lot of burden in society, especially in the context of the family.
Mm,
Like the family is the microcosm of the society, the smallest
yeah,
unit of the society.
yeah,
And women bear a lot of when it comes to conceiving,
mm,
um, carrying the baby,
mm,
giving birth to the baby,
mm.
breastfeeding, nurturing the
Yeah,
baby, and even
yeah,
to a large extent, training a child.
yes,
You know, you have a bad father and a good mother, you're likely to turn out if it's opposite. You understand
yes,
what I'm saying?
yeah.
But when there is a break in this chain of events, it can really be frustrating for women.
Mm,
I've seen women break down. I've seen frustrated uh, because they were not able. Because it's like what I'm designed to do, my body seems to complete desire
yeah.
to do what I'm designed to do, and that can lead to a lot of frustration, a lot of hopelessness. I've seen women borderline depression in my clinic, so it's really it can really something that tells on their emotions. Funny story. When my wife and I got married, we had some delays in conceiving, not for a long time, but a few months or so when we were ready. And
Mm.
my wife was always irritated in those moments.
Mm,
Uh, and you understand, and I'm the one that suffers the backlash when
mm.
when
Yeah,
she's
when they
irritated. So that's just that. At least for months, my own frustration, the irritability, the dissatisfaction that the woman have, she doesn't conceive. So I understand, I sort of
Can relate.
sympathize with the way they sit in the clinic. I see it more often than I would like to. And that's part of the reason, we're passionate about fertility care and giving women the best that we.
You can. Well, so for everyone out there, yes, and sometimes as bad as it can be when a woman is struggling with it, as much as she's hoping that that month, to be period again. When when it's not pregnancy, you see the period, she begins to worry. Oh, it means what? It's become a problem. Period is not coming
Yeah,
and all. So they're just in between. They really don't know which one. Like, okay, should be. I mean, it's really a devastating period. I can imagine what women actually go through. And sometimes the funny thing is sometimes they know because sometimes it can even be demanded because of the problem, but the woman receives the hits, gets the backlash and all. She cannot be telling you that what is the problem. It's their like you said on Wednesday that it's a couple thing.
yeah.
It's not just one woman. Well, that's why I get to raise the hope of someone. So at what point should someone start hoping that it will happen and just begin to seek help? Like maybe if they've been in the point that how long should a couple and then after trying to happen, seek help?
Yeah.
How long? Because should they keep trying and then get to a point? So how long?
Well, what we recommend is when a couple starts trying to conceive,
Hmm.
they are young, maybe in their 20s, especially the woman if she's in her 20s, and and there's no apparent problem you understand that you
Yes.
can note. We usually encourage them 80% will get pregnant after 2 years, another
Wow.
90 will get pregnant after 3 years.
Mm.
So we usually say, okay, wait at least a year. If you are not pregnant after 1 year, then come and see a doctor so that
You
you can be
can
evaluated.
evaluate.
Is there a problem? If there's a problem, let's intervene and do something about it. Or if there's no problem, do we need to do something to address it? So we say wait a year, but 30s, 35, we don't want you to wait that long
Long. Mm.
because that ovarian reserve and all
Yes.
that and all
Mm-hmm.
those. So sometimes we say, okay, wait 6 months, don't get pregnant, come.
Come and try.
However, if a couple presents to the doctor and there's something obvious
Hmm.
that they have, you don't have to wait to investigate the person. Yeah.
So hope Akashi, it's the last one for me. If for example you're coming maybe for the first time to see the doctor, maybe just check yourself, not as if you have even done anything, and then there's obvious issues. You don't have to stay, no matter how you even if you're 18 years, no
It's
matter
true.
how long, you really don't have to stay. You don't have to wait that long to get evaluated for the problem. How will people know there's a problem? What are the things they will see that will make them feel that okay, there's like a problem with fertility
Yeah.
and yes, they seek help on time instead of waiting and waiting for so long.
Okay. I would say of all, he- she had any history, probably suggesting things like maybe weight gain, if she has hair, in certain areas that a man would. Those are signs, subtle telltale signs that tell us, okay, this patient might have PMOS, and
Yeah.
PMOS can be a cause of infertility.
Mm.
Infertility is one of the symptoms and complications. So if you see that, then it's better to investigate the person, right? If the person has had surgeries that affected some um, genital tract,
Mm.
those are reasons to investigate. Okay, if a woman has had probably had pregnancy terminations, those are things that cause us not to wait to investigate. If they've tried a few months
Once
and they're not getting pregnant, we need to look a little bit more closely and
closely.
see if there's any problem.
Okay, so viewers, hope we are noting that so that you don't just stay and say, let me wait for the normal 1 year or normal 6 months. Because I remember that there was this young man that I think he came said having random sex like he had you know he has been pregnant, so he wanted to check himself. I mean, well, yes, as much as there are people, maybe you've tried and you are seeing that nothing is happening, it means it's an indication. And surprisingly, he actually came. There was absence of no sperm cell.
Hmm.
So it means he was that's just a young guy. He actually figured out early.
Yeah.
So now he now start looking for
So
what
yeah,
exactly. So imagine that he waited for when he will be married, and then he marries into a woman just starting to get problem with
yeah,
diagnosis and all of that. So these are small. Sometimes you see things. There are pointers that you don't have to wait and keep waiting. You just have to seek help and seek help. Um, so um, so sometimes some people like you see be getting common. Some people on their own, when they just see the sign, want to start doing self-medication. So is it now social media has a lot of things, and even Google, chat, everything gives a lot of information. Why is it important to avoid self-diagnosis and rely and like those people that rely on all this social media? Why is it important for them not to rely on all this social media and all this information
yeah,
and come to seek proper help? So why is it important for them to do that?
yeah. I call it Dr. Google.
Oh
Yeah,
yeah,
many people that
yeah,
patronize Dr. Google. So they give symptoms, give them a couple of diagnoses, and then
yeah,
they pick one or two and run with it. The problem with that is that if you don't have medical knowledge, yeah, or medical training, is difficult for you to see this information to get internet, right? Difficult for you to put one and three together because the way we as medical professionals reach a diagnosis, look at the patient's history, we have to examine the patient, we
yeah.
have to run some investigations,
Mm.
you understand, before we can reach a conclusion or a diagnosis and a treatment plan. If you don't that sequence of events, sometimes you can have a misdiagnosis, right? And you don't also just listen to people's stories because I see many people come and say, okay, my neighbor, my mother, my sister said that she had this, so
Yeah,
maybe
yeah.
this.
Mm.
Somebody's story is likely not going to be your story.
Mm.
Understand? So it's important to seek professional advice, to seek
Advice,
professional
yes.
care, professional help, so that you can be properly evaluated, and then we reach the right diagnosis and procure and provide the right care.
Okay, so having established all this, that you really don't have to sit back and get all your information from Google. Sometimes funny thing, the age that we are in now, even as doctors, I'm sure you've experienced as doctors, you guys experience this, that you're communicating with a client and then the client is just Googling and checking what the doctor is saying. Does it tell you what? They now seem to believe now they will now compare notes, compare what the doctor is saying with what you're getting from maybe one doctor that did something on social media. They just and then they begin to compare notes. Well, it's good that yes, as much as you're comparing notes, it's good that you get a standard place, a standard fertility specialist. Sometimes you have different people and their expertise and their different level of experience. But it's good that you actually get or go to a good place that has a good standard with very high expertise, like you have at house hospitals. So you're certain that whatever information you're getting, you're getting world class information, you're getting global class information that would actually be of benefit to you and prefer solutions to whatever you might be dealing with. Of course, Nobody will give you an absolute solution. They'll just give you options around it and allow you to make your decisions, right? So please, this Google, I'm not discouraging you guys from doing Google and social media, but let's go try it and know what we take
Yeah.
and what we need to see the doctor for. So having established this, who are those people that would actually be our candidates for IVF? Who are those people that you would outrightly, regardless of their age, you just outrightly tell them that it's IVF that might just be with for
Yeah.
them.
Well, there are several things we look out for. There are things we call indications for IVF, for
Yeah.
instance. And one of the leading um, indications for IVF is when a woman has blocked tubes.
Mm.
You understand? So if her fallopian tubes, which are the pathway through which the eggs leave the ovary and get to the uterus, if those tubes are blocked,
Yeah.
then it's impossible for the woman to conceive naturally because there's no, it's like the road is blocked. So the eggs can't
Yes.
pass
They
through.
can.
Of IVF. IVF circumvents the fallopian tubes, okay, and then we're back for her, right,
Mm.
outside her body and
Yeah.
transfer. So, number one indication, and there are many things that can cause blocked tubes.
Mm-hmm.
Leading cause being infections. Okay, so if a woman has had probably pelvic inflammatory disease in the
Mm-hmm.
past, right, if she has had that was poly, okay, if it was poorly treated, it can block the tubes. Um, Other things that can cause inflammation in the uterus can block the tubes. Maybe she has had a baby before, had endometritis, block the tube.
Wow.
Or if she has had maybe ectopic surgery in the past.
Mm.
If you have had two ectopic surgeries
Um,
on two different tubes, the doctor
yeah.
definitely will remove the two
Yeah.
tubes, right? So you
So
don't have the tubes
anymore.
again to be
Yes.
so
Right.
that's one of the indications. Another indication for IVF could be as a woman is getting older and she's not able to, women with advanced maternal age.
Yes.
Yes. And also things like maybe check the sperm. There is a problem with the sperm count, sperm parameters in
Yes.
total. If it is severe to moderate endospemia, we
Yeah.
will usually counsel to do an IVF because the process of conception needs quite a number of healthy sperms to be able to fertilize an egg. So when you don't
Yes.
have that number, then it's good for us to take the sperm, take the ones
Yes.
that are
Yes.
good, and put it, yes, in the medium with the egg to
Mm.
be able to conceive.
And that's what IVF is called, assisted and not
Yes,
as it's assisting. The sperm seems to be bad. So IVF will apparently, since the sperm find it difficult to get to, should it be that the tubes, for instance, if the tubes are open, sperm is not able to beat up with them. Of course, IVF actually assist
yeah,
with that to help out. Are there other indications that people, are there other things that people might be doing? What people that maybe are not in their period, like you mentioned, to
yeah.
us, advanced.
Was things like formerly
Mm.
PCOS.
Oh,
Yes, you can do.
with equality.
Yes,
Oh, okay. So, for those of us that are watching, you can see that IVF can actually be recommended for anybody. Maybe you have a girl and you are looking for a boy. It can just
yeah,
be it can be a way instead of doing chance. There are some people that are moving it to chance and now five girls don't enter.
yes, it's true.
So you
You can
see
actually
IVF
do sex selection with IVF, and you do sex selection. So you transfer just the gender, the
yeah.
location of birth
Hmm.
for her.
So you see that a lot of so even if no matter how you feel like you're fertile, you might just be at the point where you still need to have an IVF just in case you're looking for a gender. Or this same sex couple, yes, even as much as we don't preach it like in Africa, in Nigeria, but it's happening. We cannot close our eyes to the fact that it's happening. Yes, they go for IVF, they go for even surrogacy to have their offspring and all of that.
Mm.
So these are some of the reasons why people have IVF. And that is why you see that IVF is not far from you anymore. Like your next door neighbor might even be having IVF and you really don't know. They don't come to announce. They don't come to even when they give the testimonies in their various places. Most people don't come up to say they did IVF.
Mm.
But a lot of people are beneficiaries from a lot of IVF, and then you just still want to discourage some people. Well, what's your opinion with respect to IVF? Some people know what IVF has actually come to, because some people just have very wrong notion about IVF. What's your opinion? How can you help make them accept IVF? I mean, viewers watching right now.
Hmm. See, number one, there are a lot of misconceptions
Yeah.
about IVF,
Maybe we
right?
should even talk a bit about that.
Yes. So there are many misconceptions. One of the leading misconceptions is that people think that I've seen a couple that I had some issues, right?
Yeah.
And I counseled them for IVF, and the way the man was vehemently
No.
opposed
Wow.
to having IVF. I asked him, why. I tried to say he
Yes.
asked me, IVF baby is normal,
Wow.
and
That people
I
still
was
have this
taken aback.
notion.
I was taken aback, and I said to him, of course they are normal, because the fact that they are fertilized outside the body doesn't make them abnormal, because it is your sperm and your wife's egg that
Exactly.
is used. So the babies are 100% yours. You understand? And they are 100% normal. So there's this misconception. There are also there are also people who don't um, um, subscribe to IVF for religious reasons.
Yeah.
Think uh, it's not accepted religiously, or
Mm.
some people choose to wait on God. You understand?
Yeah.
And wait on God, wait for God to do a miracle for
Yeah.
them.
Yeah.
And I'm not opposed to miracles, right?
So
I'm
it
I'm,
they happen.
I'm also a man of faith, and I've seen God do very interesting things. I can't explain that. Man say, Baba, now you do this one. You
Exactly.
understand?
Yeah.
But my disposition is that you need to do everything humanly possible to have what you need to have. If you want to
Mm.
have a child, do everything humanly possible. Exhaust all the options.
Mm.
You understand? And then if it doesn't work, you can trust God for it. I say something. Miracles are the right hand of God. Science is the left hand of God.
Mhm.
And
Wow.
God is ambidextrous.
That's
He can work with his right
clock
hand, he can work with his left hand.
Yeah.
You understand? And so God can do miracles for you, science too. So you don't have to um, uh, disabuse your mind to the fact that uh, this is from IVF and all. It's science, it's technology, and God is the one that gives the knowledge for us to be able to do things that we do. Yeah. So um, nothing is wrong with IVF. IVF is perfectly okay. And babies are perfectly human, and you can have your children IVF.
Mm. The way you just speak, I actually just had a very crazy thought, like, just the way some people just wonder that IVF is strange, IVF babies are not normal. So, but then if I know that we believe in miracles, so a woman should just stay on her own and let the sperm meet her without them having to meet as a couple. Because sometimes you just wonder, they still have to make efforts for that pregnancy to happen. So if you can make effort to have an intercourse to have
Mm.
a baby, it means that God did not come down from heaven to tell you people should have sex. Like you made effort to know that this is what will be done. So now, if you have another means that still put the same garment in you, or yes, when the need arises, that it don't has to be. I mean, something that people should be open to embracing, because we all, at one point in your life, your effort to achieving pregnancy differs. Some people have to go the IVF route, while some people spontaneously they just meet, and then yes, pregnancy happens. Whatever your effort is, the thing is you are making effort,
Yeah.
hoping that God will bless you. And that's why 100 IVF is not 100%,
Mhm.
and it's not guaranteed anywhere in the world. And that's why we should embrace this technology, because it has come to stay. God has used this technology. Like I really love what Dr. Samuel said. He said, technology. You said technology is the left hand.
Miracles are the
Miracles are
hand,
the right. Yeah, yeah,
and
and
God is ambidextrous.
mm,
Both his right
and
and
his
his
left
left
hand.
hand.
So it could be either of it. It could be either of it. You can any of the hand you want God to use for you. You can tell God to use them. But then is all we're trying to say is that if you have this open mind to embrace the technology that has been made available, I'm sure that and the funny thing is sometimes when you have these people come eventually to accept IVF, they will wish they came earlier. And
Exactly.
that's
Correct.
always the sad thing Because now we are blowing the trumpet, we are trying to enlighten people, make them know that this is the technology available. And then some of them, I remember Dr. Ken once mentioned how a lady was so unhappy because one of her spiritual leaders stopped her from coming. And then eventually when she came to terms with it and came, they were telling her she didn't have eggs anymore.
Mm.
And then she would, people will feel filled with regret. I knew this. I mean, now we've been saying freeze egg, freeze egg. Some people later, maybe 5 years time, they'll not say, I wish I had done it then. So never say never. If it's available, why not?
Mm.
Well, um, as we go towards ending this show, what's your final counsel to people out there? Because we're talking about giving up. Is there hope for them? For a man that they've told you don't have any sperm cells, and you just stay at home and crying and hoping that miracle will happen. Should they keep staying like that? Should they just keep staying when you have sperm cell, or a woman knows that her ovarian reserve is already declined, pregnancy doesn't seem, or her tubes are even blocked, and she's just should they keep staying? What's your counsel to them?
Well, my counsel is simple, and my counsel is that um, seek help. Okay,
Hmm.
seek help early. Don't wait until um, it's too late, because the thing is that the younger you are, the more options you have, even science
Hmm.
wise.
Hmm.
But the longer you wait and the older you get, the options you have become narrower.
Narrower.
You understand? So my counsel is that wherever you find yourself, there is hope,
Yes.
there is science, there's technology that can help you, regardless of the situation you find yourself. So seek help early, seek the right information, seek the right people that can help you. Don't depend on internet, on friends' experiences, and what you hear from church leaders that are misinformed, or religious leaders that are misinformed. Come and seek for help. I will be able to do something to help you achieve your desire. Okay? So all hope is not lost, actually. There's hope for those that still want to have their children. Come and see a fertility specialist.
Bible says there's hope for a tree when it does that.
Yes, at
It
the
is
scent of
sprouted.
water.
Oh
Yes,
yeah,
to
it
start
is
again.
sprouted exactly. So it means
Start
that
again.
no matter how they told you, no matter how bad they've described it, there's just a way. As long as you are open to accepting the options you have available, because sometimes some people they throw these options at them and they are not open to accepting it, so they would rather just stay the way they are. But have an open mind and just embrace things the way they are. Yes, it's a very beautiful thing to have to nurture babies, nurture the ones you call your own, like I mentioned on Wednesday. So whichever means that is ideal with respect to science and technology that's made available to you, please, we counsel that you're all open-minded. And we hope that someday you'll be able to achieve your fertility dreams sooner or later. And yes, for those of us that might just be hoping to communicate with us at our hospitals, you can actually book an online consultation just in case you feel you cannot access us here in Jos or center in Abuja. You could actually speak with us online and we could plan it from there. But for now, till we see you, we hope that you enjoy the rest of your weekend.